In this presentation, I would like to talk about female orgasm issues. We call it anorgasmia. It's one of the most prevalent sexual complaints in women, unfortunately. However, it's most confused and muddled topic because it's a very complicated issue to resolve. And even though the majority of women who live on this planet are able to achieve orgasm in one or another way, there are a lot of women who suffer from this sexual function issue. And in this presentation, we're going to look at what causes women to have this issue and what are the ways to resolve this. Anorgasmia, or female problems with orgasm, can be classified into the following categories. So the first one is primary. Primary is when a woman never ever experienced orgasm in her life. And then we have secondary form, when woman experienced orgasm in her life, but then at certain point of her life she stopped experiencing it. And she might still experience it under certain circumstances, or she might not. So that will lead to a subcategory of this condition called absolute or situational. So what it means that if a woman has secondary form of anorgasmia, she might not be able to experience orgasm anymore, even though before she was able. And now something happened, and under any circumstances or using any means, she's not able to do it. And then we have situational subcategory, when women might still experience orgasm, but under specific circumstances. And the interesting thing is that women who suffer from anorgasmia, they can still have a very strong sexual drive, they can still fall in love, they can still enjoy sexual foreplay, they can still lubricate during sexual foreplay, and also they can enjoy penetration, sensations of penetration, but they won't be able to climax. And they kind of like stuck in that plateau stage. And plateau stage is one of those stages of orgasm when like before climax happens. So, and these women who suffer from sexual function issue, they are stimulated sufficiently in order to be able to achieve climax, but for some reason they are not able to. And interesting thing is that again, generally orgasm occurs more easily to women who are highly aroused. However, the level of arousal and the level of orgastic threshold are two independent processes, and they can even be inversely related at times. So, for example, a woman might be in relationship with someone who she's not very much emotionally connected. She feels safe with him, but she's not very much aroused by him. And during sexual intercourse, she might experience orgasm. However, the same woman being in other relationship with the different person who she's highly aroused by, who she's very much emotionally connected, who she really wants to impress and really wants to achieve climax with, not able to do that. And these are basically situations that are quite complicated, and we're going to look at different reasons why it might happen. Anorgasmia, or absence of orgasm, is a sexual function issue that can exist independently or coexist with other sexual function issues. And when we talk about female sexuality, the other sexual function issues are low sexual drive or no libido, painful sex or dyspareunia, vaginismus or sexual aversion. We're going to talk about these sexual function issues in different videos, in separate videos, because there is a lot of information about each of these sexual function issue, but just kind of to let you know that they can coexist with anorgasmia or exist independently. Unlike male sexual function problems, females' sexual function problems are rarely caused by physiological factors. Mostly female sexual function problems are caused by psychological issues. However, there are a few physiological illnesses and issues that can contribute to female sexual function problems. One of them is problems with endocrine system, especially with a pituitary gland that is responsible for the production of testosterone. Remember that testosterone hormone is very important for female system as well. Of course, not in that quantity as in male system, but testosterone is the hormone of sex. So when its production is affected, then it can directly have an impact on female sexual drive, libido, and of course her ability to achieve orgasm. So it's quite important to remember this. Also, any kind of illness that can have contribution to muscle tone or contractibility, because obviously when a woman has orgasm, her muscles are involved. All the muscles of her brain are involved in the process, and most muscles of her body are also involved in the process. So if there are any kind of blockages or any illnesses that prevent that, that can have an impact. Also, any kind of condition or illness that affects neurological apparatus, that can lead to, for example, multiple sclerosis or diabetes or any kind of illness related to neurological system. Contraceptives can have impact on sexual responsiveness and ability to achieve orgasm. Such drugs as methadone, heroin, morphine, Demerol, codeine can cause the impact on the central nervous system, sexual center, and of course affect ability to achieve orgasm. Depression, stress, fatigue, obviously anxiety, these are kind of issues that affect both men and women. And very important moment here is the condition of pelvic floor muscles, especially pubic coccygeal muscle that is very active in the process of orgasmic release. So any damage or weakness to these muscles or lack of sensitivity can lead to problems with orgasm. When we talk about main causes that create problems for women to achieve orgasm, we talk about psychological causes, and one of them is inability to relax. Inability to switch off mind and to kind of surrender to the experience, and inability to let things go when there is a very high level of anxiety, very high level of insecurity, being in that kind of condition of alert. That causes a lot of problems in sex. High level of emotions like guilt and shame, because guilt and shame, they increase the level of anxiety, and they produce hormones that lead to fight or flight response rather than relaxation. If a woman suffers from different types of unresolved conflicts with her own sexuality, with her own kind of role as a woman, with her obviously self-esteem, confidence issues, it's very difficult for her to achieve orgasm. Negative body images also can contribute to anorgasmia. Ban on pleasure due to many reasons, or fear of death. So fear of death, because orgasm is historically kind of presented as a small death, and that's not because of its ability to kill you, but it's because of that state that you enter when you experience it, and it's a total loss of control. And for some women, it's associated with death, and that's why there is a fear there that if I lose that control, I will die. In fact, this is again coming back to that ability to let things go, to relax. Also, detachment from body, feeling that your body doesn't belong to you, and delegation of that responsibility for pleasure to other person or to partner. So lack of sexual education, that's one of the biggest reasons as well, and also the impact of religious, social influences, system of beliefs related to on sexuality, to relationship with men, problems in relationships with partner and men in general, unresolved conflicts with parents, especially with father, and traumatic experiences. Treatment of anorgasmia can be quite complicated and long, but in most cases it can be very successful if a woman is really motivated to resolve this issue, if she gives herself permission to resolve this issue. And this program or the therapy would include different aspects. So it would include educational aspect about sex, sexuality, about a lot of things that related to orgasm. Elimination of any negative impacts from the past. So if woman went through some traumatic experiences, or if she had any unresolved conflicts with her past, or with her parents, or with her father, or with her exes, or with men in general, or with herself. So eliminating this negative impacts of that experience. Training of being aware of what's going on, of ownership of her body, of her senses, connecting to her emotions, to her pleasure, being able to relax, also not being scared of pleasure, because unfortunately there is a fear that is very much connected to the emotion of guilt and shame that is around pleasure. So obviously dealing with that, and then of course learning techniques on how to achieve pleasure, and pelvic floor training that is important, then plays quite substantial role in the ability to achieve orgasm. And of course working with relationships, because if woman is in relationship, there could be something that contributes to her inability to achieve orgasm, related to maybe issues with trust, maybe some conflicts going on in the relationships, maybe dealing with some kind of traumatic experiences, maybe lack of understanding or skills from the partner. So obviously 90% of female orgasm will depend on a woman herself, And 10% that are quite important, they're essential 10%, will depend on her relationship with her partner, his skills, his support, his ability to communicate effectively, his ability to provide safety, and of course his motivation to support her in this process and to help her to achieve orgasm. I've been working with women who are suffering from anorgasmia